Great. Welcome, everybody. Good morning. It's great to be together for this very interesting session. This is the second meeting of the Spring Bits Open Research Seminar. We're just delighted that you can join us. My name is Ted Miguel. I'm the faculty director of the Berkeley Initiative for Transparency in the Social Sciences. I'm based here at UC Berkeley. If you're new to BITS, I see a lot of familiar faces, but there's some new faces as well. We were established around a decade ago in 2012 to try to improve the credibility of social science research, where our goal is to advance transparency, rigor, reproducibility, and ethical research. And we do this in a few different ways. The initiative tries to generate evidence about the problems and solutions in science through different types of meta research. We promote increasing access to open science education through seminars, workshops, and our research transparency and reproducibility training. So certainly this seminar today is part of those activities. And we also work to strengthen the scientific ecosystem by developing new tools, policies, and protocols that advance open science at scale. The BITS Open Research Seminar that this is a part of is generously supported by the Templeton World Charity Foundation. We're very grateful to them for their support. And the sessions this semester are a continuation of what we started in the fall. And the goal of these sessions is really to promote and share knowledge about the latest thinking on best tools and best practices in research transparency. So this spring, we've already had one session. We then have the session today with a fascinating lineup covering topics in research ethics and best practices. And you're going to hear more about the speakers in a second. And we have two more sessions this spring that we hope you'll tune into. The next one will be on April 20th, and it's focusing on building student-led reproducible research, featuring speakers from the University of Arizona. And then on May 2nd, we have a session on launching the MCC evidence platform, why usable evidence tools are critical for impact, led by colleagues at the Millennium Challenge Corporation. So please check out the event website to get more details on the open research seminars. Make sure you're subscribed to the BITS newsletter, and you can do this by checking out our website, bits.org, BITSS.org. You can also follow us on Twitter at UCBits. So, please make sure to stay tuned for updates. There's a bunch of different activities going on here at BITS. So again, thanks to our speakers, thanks to those who submitted proposals for the seminar. And again, we're very grateful to the Templeton World Charity Foundation for allowing us to put this series together. So let me just turn it over now briefly to the BITS program manager, Grace Hahn, who's going to introduce our speakers and give us a little more detail on the session today.
Thank you, Ted. Hi, everyone. So excited that you're able to join us this morning. As Ted said, I'm very happy to introduce the speakers in the order that they'll be presenting. So first is Alfredo Burlando. He is an associate professor in the Department of Economics at the University of Oregon, and he's also a SIGA affiliate. He received his PhD in economics from Boston University in 2010. His current research is in sub-Saharan Africa, and it employs randomized interventions to study the impacts of financial inclusion, including savings groups, digital forms of credit and payments, and microfinance. And a particular focus of his work is the inclusion of vulnerable and marginalized populations. Presenting second is Indira Patil. She's a research associate at the International Initiative for Impact Evaluation, or 3IE. She provides technical support to various impact evaluations and process evaluations focused on livelihoods, health, education, social security, and gender. And she also supports the Transparent, Reproducible, and Ethical Evidence work, or TREE, at 3IE by leading the research on enumerator health and safety and managing the RIDIE registry. So she'll talk more about that later today. But first, Alfredo will kick us off with talking about sort of what we owe to research participants and returning research, the ethics behind that, and sort of I anticipate to be a very interactive session. We'd love to hear from all the participants about your different experiences working in this field, as well as thoughts you have as the presentation goes along. So I will pass it over to Alfredo. Go ahead.
Thank you, Grace. It's a pleasure to be here. I very much appreciate the opportunity. I'm very excited for this session. I think it's going to be really interesting. Let me share my screen so that we could, I have a set of slides here for the presentation. As Grace said, for the next 20 minutes, you will hear about what we owe research participants. And in particular, I want to focus, and we will focus in this presentation on the end of trial obligations, if you will, for researchers. So the title is Researchers, Results, and Participants, Who Deserves to Know What? The project is really it's a proposal that tries to address the following questions. Should researchers share the results of an RCT with the study participants at the end of the study? Okay, so that's kind of the question that we pose with this project, and we put together a proposal to the NSF. We submitted that to the NSF, and the project is still in the planning phases. But nonetheless, part of the reason to be here is to gather feedback and ideas from you guys, from the participants in BITS. The project is focused on randomized controlled trials in development economics in sub-Saharan Africa, and the reason for that focus is because the three PIs have an expertise in these three domains. And by the three PIs, what do I mean is, I mean myself and Ted, we're both development economists, as well as Melissa Greyboys, who's a colleague at the University of Oregon, and she's a historian focused in bioethics and medical history within the context of East Africa and Sub-Saharan Africa. Okay, so we have put together this interdisciplinary team to address this question. And again, we're gonna, by the end, we're gonna seek feedback. Hopefully, this is a project or an idea that you will find interesting, and you might want to talk to us. In which case, please put your name down, and we'll contact you. Part of the reason to do this presentation before we even know whether or not we got the grant is not necessarily to count our chickens before the eggs have hatched, but really we think that the topic is interesting. And it goes even beyond this proposal to this grant proposal. So let me frame what we're going to do today in terms of transparency, since this is a BITS seminar. And so when we think about research transparency, typically we think of an audience. There is somebody that we're transparent to. And so who is that audience? Typically we think of a set of individuals that fit these broad categories: researchers, policymakers, those associated with journals, readers of journals, and typically just the general audience of consumers of these research. Okay, so really our attention tends to be focused on the consumer side. But we can also think of a different audience as well, who are made up of the co-producers of the research, those who actually help the researchers accomplish the goals of the research and generate knowledge. And those are going to be the research partners, the NGOs and organizations that we partner with in our development projects, the field workers, and we'll hear a little bit more about that in the second part of the presentation. And also research participants, they are also help us generate this new knowledge, and they are active co-producers of that knowledge. And so that's what we're going to be focusing on, our attention. So we want to be transparent towards those study participants. And in some sense, we already are transparent because we are required by IRBs to provide information to participants about the study during the onboarding process and the consent process at the very beginning of a study. The consent process is something that is really foundational and really important for research. It's first of all, it's a legal requirement. We're obliged to do this, but it allows the researchers to gain informed understanding and voluntary consent from our participants. And it is a moment of time where we are disclosing to those participants what are the risks, what are the benefits of participation. What are the objectives of the research? It allows the researchers to meet some ethical obligations, and in particular, the respect for persons, that allows the participant, gives the information to the participants so that they have the autonomy and the information to decide whether it's in their best interest to participate in the study. So that's what we do. And typically, transparency kind of ends there, but we can think of that as actually being something that we could continue on over time. And what I want to bring your attention to is the transparency that can occur at the end of a study once we have finished our activities and we have a set of results. And at that point, we are in a position where we could actually share those results with the study participants. And we can think of a variety of mechanisms through which we can do that, through focus groups, flyers. You can write reports that go to local leaders, asking them to share it to their community members. And there's other lots of different ways in which that sharing of results can occur. So let me, before I move any more forward, let me stop for a second and ask the participants here a question. In your opinion and based on your experience, what do you see as the common norms and practices around sharing results with research participants? I'm hoping to gather some feedback from you guys. And I'm going to put the timer on for a couple of minutes so that to give you time to chat in the chat. I'll give you another minute, and even feel free to write a short message. Yes, no, that kind of feedback is also helpful. Okay, so thank you so much. This is already. Feel free to continue with the feedback. But it seems like people are saying yes, there are some sense that we should be doing this, but maybe it's not really common. Okay, so that's. And when we looked at the evidence in preparation of this grant, that's kind of what we found, right? That we looked at the written records and in search of evidence of this norm. And so we looked at the law, right? Legal requirements from IRBs, and in the United States, at least, that's something that it's not asked. It's not a standard obligation from funders like NIH, NSF, or some of the private foundations that we've come across. We looked at ethical guidance from like the Belmont report and others, and again, there is no discussion of this issue, nor is discussed in RCT guides. Now, there's been a couple of papers that focused a little bit or had some focus on ethics of RCTs in the economic development literature. And there, what do we see? We see, we have a couple of quotes. One says the practice is inconvenient, expensive, and logistically complicated. and that sharing results may be unwanted or misunderstood by participants. It is challenging to explain complex research findings. It might cause participants to behave in undesired ways. So basically, there's not much, and maybe that should be, you know, an answer to the question is, well, it's why should we bother doing this? Given these concerns and the lack of norms at the moment. Let me now basically turn into the case for sharing, and I'm going to make three cases, three main arguments. The first argument is an ethical argument, and it's basically we have an ethical obligation when doing human subject research to meet some ethical criteria that have been established or enshrined, let's put it that way, in the Belmont Report and other foundational documents. And in those documents, we see the three main ethical obligations as respect for persons, beneficence, and justice. And we think that sharing speaks to all three of these items. In terms of respect for persons, by sharing the results, we recognize that the participants are active co-producers of knowledge, and by providing them with information about the results of the study, then we make them active participants or active, you know, we provide them with the knowledge that they themselves were able to generate. It also recognizes that participants might actually use the information that was generated in the study. And so it is something that they might actually value and apply in their own life. And that speaks to the second point with this, which is the beneficence point, which is by sharing results with the participants, we have the potential of allowing them the tools to maximize the benefits beyond even what we the narrow scopes of the research. So it is we have an obligation to maximize benefits and minimize risk, and we should think of sharing as another tool for us to accomplish that particular task. And so those are the two main arguments I'm willing to make in this presentation. My colleague Melissa would also argue that there are also other arguments based on justice, and I will let her make those arguments herself. But one more point I want to mention is the fact that you know, even though sharing results is not written as specified in things like the Belmont Report, that doesn't stop us from considering those kind of practices as ethically viable or correct. Mostly because when doing international research, we do have to acknowledge the fact that locals have local ethics and that we must be respectful of those local ethics. And we already, in our current practices, we already engage in practices that are respectful of those local ethics. For example, when we do group consent ahead of individual consent, that's something that we do because we respect local needs and local concerns about getting approvals from the community before you go to the individual. And the same for oral consent as a substitute for written consent. Okay, so we already adapt our practices to meet local ethical guidelines, if you will. A second argument is a historical argument, and again, here comes really our colleague Melissa is the person that has really worked on this. There's been vast amounts of research in social sciences and biomedical sciences in sub-Saharan Africa for over 120 years, 150, 140 years. And a lot of that research has been extractive and coercive. So the history of experimentation is not pretty, it's not a pretty history. And moreover, work by current economists like Sarah Lowe's, Nathan Nunn, and their co-authors suggest that those researches that were done long ago have current effects, have long-term impacts in that they reduce the willingness of local populations to engage with current research. And so our practices today have an influence on futures, on the future and how people are going to perceive research participation to the future. So we need to consider our ethical obligations as an ongoing process. There are still large differences in perception between what the researchers, how the researchers perceive research and how individuals in the communities that we study perceive that research. And even though that we have now these guardrails from IRB, we have the consent process, we allow people to withdraw from a participation of the study at any time, these are not necessarily, the question must be asked, are these guardrails sufficient to cover all the ethical obligations? May we actually need to do more in order to actually fulfill and always improve our obligations? And so we think that sharing results might be one of the steps that we can take today to make those improvements into the future. And finally, sharing is actually good practice. By sharing the results with local populations, we may actually improve how we interpret results of research, right? Sometimes we get contradictory results, and local participants might have a sense as to why we got a certain outcome that could actually improve the quality of the analysis. This is already something that we currently do, right? In many times, in our current practices, we go back and we have focus groups or qualitative interviews to discuss the results and make sense of what we get. And so that's something that we could, that we already know how to do, but we don't do that systematically. And so for these reasons, we think that this might be a worthwhile norm to pursue in a more systematic way. And to do so, our proposal has 3 broad objectives that we hope to carry out over the period of 3 years. The first objective is to really establish what are the norms in particularly in development economics, but also in related fields like anthropology, demography, and political science. And so we will be we'll spend quite a bit of time reviewing published work, published RCTs, looking at IRB protocols and pre-analysis plans. We'll be looking at what IRBs in Africa require in terms of sharing, to try to establish what people do and how this research has been, how this sharing has been considered or done in the past or not. Second step will be to gather perspectives from economists and African participants. We will be interviewing development economists. We'll take advantage of the SIGA network to do so. And as well as we will hope to target some participants of RCTs in Sub-Saharan Africa for interviewing. And this obviously will not be a representative sample, but at least will give us a sense of what are the perceptions about sharing from the field. We'll take all of this as inputs to what we hope to be the main output of the project, which is a document that is a proposed best practice document, where we basically lay out a proposal for a shift in our norms regarding sharing. We will present that to the community, and we will engage in the community in a discussion about that set of proposed practices, and to see if we can come up with a document that we can all appreciate and use in the future. Now, I've already been chatting with people about this project. It's sort of interesting, and during seminars and conferences, I have good chats over beers and socially. And typically, what I found is that this topic elicits initially really strong reactions. My favorite quote is from somebody whose first thing that blurred out was, "Oh, do you want to have new enemies? Like, we're proposing something that people will seriously oppose." And no, the answer, if you know me at all, you know that I don't want to make any enemies. That's not what I like to do at all. But nonetheless, we think that, I think that we can work through some of the questions that are posed here, or some of the issues that might stop us from adopting this practice. So, for example, people ask me, well, do people actually demand information? Do they demand results of the study? Do they, if I'm doing an RCT that has long-term follow-ups, what's the impact of sharing those results? Would that affect my follow-up results later on? How should we think about the interface with partners who also have a stake on the reports, on the results, and how those results are reported to participants? Is it going to add to to our workload? Already RCTs are very time-consuming, and so we are they are somewhat burdensome, and we might be adding something, is that going to have a real effect on our research productivity? Are there ethics of unintended consequences? Information not always is positive, is beneficial. Sometimes it may be harmful, and alternatives. And should we consider other alternatives to sharing information, such as paying participants not to receive the information? And more generally, how would we go about and enforce the new norms? I'm really out of time. So, these are really good questions. And the point is, if you ask me over years, I will have opinions about how to address these questions. But the point is really that we are, norms do shift over time. They evolve. We think that this might be a direction, that it will be a positive direction. And I think that we have answers. We will, as a profession, we will have answers to all of these questions and more. Again, I want to emphasize that this is very much, we're very much open to hearing opinions and current practices, ideas from all of you. If you want to write some more in the chat, please do so. We have a Q&A, so happy to answer any questions right now. And obviously, feel free to email any one of us. Thank you so much.
Yeah, hi, I'm from India. Yeah, so I just joined the session late. So will it be possible to get the recording later or something, some update? Yeah, because I joined late at some other meeting in India.
Yes, we will share all the recordings through our social media, our newsletter. It'll be on our BITS YouTube channel, so no worries.
Thank you.
Is it possible, sorry for interrupting, to ask a verbal question?
Yes, please. Anyone can feel free to chat or unmute to ask your question. Go ahead.
Oh, okay. Thank you so much. I hope my voice is clearly hearing. So my name is Tariq Al-Haraj from Morocco. I am PhD student. Actually, I'm working on constitutional court, and to be more specific, I'm working on how can individuals in Morocco access to constitutional justice. Thank you so much, Professor Alfredo, for this wonderful presentation. Actually, my intervention will be on two questions. You spoke about sharing as an opportunity or as the best practices. Is it possible that sharing the result of the study or something like that can become a threat for the study itself? And if it is, how we can improve that and we can keep it on the track of best practices? Thank you.
Thank you, Tariq. That's a really good question. And yes, I mean, we obviously need to address the question with intelligence. And we need to really be thinking carefully about how information is shared, what is being shared, and making sure that we minimize risks even when we are at that stage of the research when we are sharing. And so we think that absolutely there will be plenty of opportunity for researchers to basically bring out examples just like the one that you shared, where you would be concerned about the safety of research participants. And that does not preclude us from not sharing, right? That simply means that we have to do it in, using our brains, which fortunately in our profession, I think we're pretty, we're pretty endowed with. And so that would be my short answer to that particular question. Yes, I see a hand raised, so please unmute.
Okay, I'm Balai from Ethiopia. I'm a PhD candidate in equational measurement and evaluation. The concept is new for me, but what I was raising the question was, what if you was displaying the result using pseudonyms of participants?
Sorry,
using pseudonyms or fictitious names of participants.
Mm-hmm.
That might be doesn't contradict with the common ethical principles of research normally. You keep confidentiality, the data should be anonymous, then what reporting results on this way and reporting just in this new paradigm, what makes it the difference normally on the impact? That was my question. Thank you.
So this is about the sharing with pictures. Is that did I understood correctly?
If you have a source of 3 or 4 participants, which may have real names, but you use a fictitious name for that person to report the results normally. You make an interview either with 6% or 7%, or you do a certain research.
So I think we're going to be focused.
Participant, you post. Yeah, I'm focusing normally. There are non-standards of ethics normally in research when you report the result and so on. Instead of using the displaying the names of the person, what if you report them using a fictitious name of
sure, yeah,
participants?
Yeah. So that's fine. I mean, typically we're really focused here on RCTs, on randomized controlled trials, which really, in some sense, are typically tend to be much larger and typically fully anonymized. But what we're sharing is not does not preclude any of the other best practices that we have for research, which includes using of anonymizing names.
Okay.
Thank you.
Okay. My concern is that might be there was. The forms of in education, if you want to compare people with achievement, might be the implication you're displaying a result, even knowing in a certain region, might have an impact normally. Because just people was considering that result as unwise comparison of either ability or.
Yeah. So again, these are the set of
like that. Economics might not exist this limitation. Hopefully.
Sorry, I apologize for jumping in before you were finished, but these are the set of concerns that I think we want to hear about, and these are the sort of concerns definitely that we will grapple with in our work, and that the profession will have to grapple if we think about adopting norms of sharing results. And so I don't feel that this is my role right now to provide answers to those questions, but it is definitely my role to collect those kind of concerns and think about them going forward. Sure. Thank you.
Yeah, I have one question. Can I go ahead, Varun from India? Yeah, thank you. Right now, I am working on a impact evaluation study of a corporate social responsibility. Now, one of the challenge which we face is about selecting participants for the survey, the beneficiaries. And the reason being is what happened is generally when we get a list from the company about the beneficiary list, it becomes little difficult to adopt random sampling, like a simple random or a systematic random sampling, just because maybe of time constraint or the farmers are very far away places. So sometimes what happens is the company themselves, the company employees, those who are part of that program, those who handle that corporate social responsibility, like a rural development program, they suggest the beneficiaries. Okay, there are certain beneficiaries, they are available at at this level, you can interview them. So how do we handle such kind of things when sometimes the time does not allow you to go for a completely a random sampling, in that framework, in sampling, the research practice. I think this is related to research ethics and sampling also, when the sometimes employees try to influence the participants or something, so generally yes. What a researcher can do, and what good practice would you suggest?
So I think that the question is, so let me answer in two ways. One is a technical question. What can you do in that case? And I have ideas, but those are sort of technical a technical aspect, right? What we do in the sampling process. And I'm happy to chat with you, maybe offline after we are done with the session. And so send me an email, and I will engage with you on the technical question. To bring it back to the research presentation that we just of the topic at hand, this what you're talking about is really related to the onboarding process. So this is ahead of the research presentation, ahead of the implementation of the research, and what we really are focused on in our with this proposal is the norms that occur once the project is actually completely finished. We already have our sample set of participants. They've been with us. And now the question is, we have results. And now the question is, what do we owe them in terms of information? So let me put it that way.
Okay, thank you.
Sure, thank you. Do send me an email. I'll be happy to chat with you separately.
Yeah.
Great. Well, thank you, Alfredo. We'll have some more time at the end of Indira's session as well. So, if people have thoughts in the meantime, or as Indira presents, please hold on to those, and we'll have a more open discussion at the end. But thank you for your presentation. And I know a lot of people have volunteered to be interviewed, so I'm noting down their names, and I'll send them to you afterwards as well, so they can be included in the study. But please go ahead, Indira.
Thanks, Grace. I'm just sharing my screen. Right. So hello, everyone, and thank you for your interest and participation in the session. I'm really excited to have this opportunity to present our study on enumerator health and safety challenges today. And I would particularly like to thank the BITS team for providing this opportunity. So on behalf of the Transparent, Reproducible and Ethical Evidence team at 3IE, I'll be presenting the study on enumerator health and safety challenges and measures. So this is a joint study with my colleagues at 3IE, Chandan Jain, who is also participating in this session today as audience, and Rohan Shah, and also a former colleague, Soumya Mathur. So before delving into the study, I would like to quickly take you all through the various tree initiatives of TREE. So 3IE champions the research transparency and reproducibility movement as a means of understanding and mitigating the challenges to credibility of social science research, and also working towards stronger integration of ethical principles into practice. Through integration of the TREE principles and practices in a research workflow, we aim to ensure that the rigor and credibility of research activities are maintained, and also aim to ensure that the research activities follow foundational principles of research ethics, which entails respect for persons, beneficence, and justice. The various activities under TREE can be broadly classified into 4 groups. So the first is the help desk, and the primary focus of help desk is to support the research teams on capacity building in incorporating various TREE best practices within the research life cycle. And this entails, training in protection of human subjects, study registration on 3IE's own registry, which is RIDE, then review of the pre-analysis plan, and also adherence to standardized reporting and citation requirements for publications. The second unit is the data center, which primarily supports the research teams on data management plans, data sharing agreements, and best practices around data de-identification, transfer, and storage practices. The data center also supports in the integration of push-button replication protocols into the research analysis workflow. The third is the newly launched TREE review framework. So this is an independent review service that is offered by 3IE, which makes a comprehensive assessment of whether the research design, implementation, and dissemination aligns well with the ethical principles. And the fourth is the TREE research unit, which actually aims to generate evidence on TREE-related evidence gaps and best practices, including but not limited to questions around, whether incorporating the tree into research practice improves quality and credibility of the research, or what ethical concerns does the research team have, and what evidence exists or on potential best practices, and where are the evidence gaps. So the study on the enumerator health and safety that we will be discussing now is one such initiative of the tree research. So firstly, let's discuss what motivated us to undertake this study. Being part of the research community, we are all aware about the importance of good quality data. Good quality data forms the basis of evidence generation in international development, and more often than not, for many studies, this data is collected using primary surveys. Surveys mostly run for days and are usually planned in a manner to keep the costs low. Sometimes surveys are done in difficult contexts and might pose risks around health and safety of enumerators. Enumerators are also exposed to difficult situations and respondents on ground. Most of us who have engaged in primary research might have anecdotal instances about enumerators being underpaid, working with limited resources and in difficult conditions. When we try to look into the literature on enumerator well-being, we unfortunately could not find many studies that systematically documented the health and safety challenges of the enumerators, and particularly say in the low and middle income country context, there were even fewer studies. In the context of India, for example, there were very few media reports or articles documenting, the health and safety challenges of enumerators. So one such media report, say, was published about 4 years back by a renowned online media platform, and highlighted the exploitative conditions in which, say, the enumerators who were part of the National Family Health Survey, which is a government-backed national level survey. And this was conducted in 2015, but I think the exploitative conditions, basically, they were underpaid and not properly trained, and no proper resources were provided during the survey. So all of these were reported in the media article about, I think 2019. The literature and the discourse on research ethics mostly, discusses a lot about the rights of the data provider in terms of, the institutional review board, human subject certification, provision of incentives, etc. And lesser attention has been focused on the issues and processes around, the well-being of field research staff who are directly engaged in data collection. We understand that it is difficult for the IRB, say, to look into the enumerator side, but an acknowledgement of the fact that this is an important area of concern, and focusing on institutionalizing measures to ensure the safety of the research staff is an important step. And it is really important to extend the principle of do not harm to ensure the well-being of the field research staff as well. So our study contributes to the literature by systematically identifying the key health and safety challenges faced by enumerators during data collection, and proposes measures to mitigate these health and safety challenges. In terms of methodology, this is a descriptive study, wherein we employ a qualitative approach to systematically document the findings and propose some recommendations. So we collected data primarily through 3 sources. Firstly, we collected information on the health and safety challenges through a survey of surveyors. So these surveyors or enumerators were part of a 3IE commission survey for an impact evaluation project. So the 3IE commission survey was conducted in low-income settlements in a metropolitan city in India. So after the survey, we conducted, the survey of surveyors, which was a self-reported survey administered using Google Forms. And the survey comprised of both open-ended and close-ended questions on enumerator, on the health and safety challenges that the enumerators faced. We also had some questions, on the enumerator background, capturing their age, educational qualification, professional experiences, etc. The second source of data was, the in-depth qualitative field essays that the enumerators wrote basically after the completion of the 3IE Commission survey. So the data collection agency, had asked enumerators to describe and write about the experience focusing on the challenges during data collection, and also provide feedback for mitigating these challenges. The third source of data was, in-depth interviews with program managers and supervisors from various data collection agencies based out of India. And all of them had experience of managing large-scale household surveys in India and in the South Asian context. So again, the objective of these interviews was to understand the institutional level challenges and also the measures, in terms of, or the standard best practices that they usually follow to, mitigate these challenges. Before delving into the key health and safety challenges faced by the enumerators, I wanted to present to you a snapshot of the background of the enumerators. This is based on the survey of the surveyors, and the average age was reported to be about 29 years. This observation was, further reinforced during the interviews with the managers and the supervisors, who confirmed that the surveyor cohort usually tends to be young, with mostly fresh graduates and early career professionals pursuing this job. Most of the surveyors held a postgraduate degree or a graduate degree. About 45% of the surveyors had a master's degree, and 40% of the surveyors had a bachelor's degree. This can be, seen in the pie chart on the right-hand side of the slide. So the data collection managers in their interviews discussed that surveyors usually had a degree in arts, commerce, or science, and also most of them mostly held a master's degree in social work, history, or say English. In terms of the contracting and wages of the enumerators, so we collected this information during the manager interviews to understand the standard market protocols and the wages paid to the enumerators. In terms of contracting, the standard market practice followed by the data collection organizations was to devise a contract of 89 days or less. This was mostly to evade the employment benefits that must be offered to the employees, including gratuity or retiral benefits and allowances, if the contract period is more than 90 days or more. And in case the survey organizations wanted to renew the contract, they usually kept a cooling off period of 7 days. And after that, they renewed the contract. Again, this is, just keeping in line with the law, so that they avoid, providing any retiral benefits or other allowances to the enumerators. In terms of the average daily wage of the enumerators, it was about $12.5 US, and actually kind of varied between different projects based on, the budget and the location. So the range was between, say, 900 to 1,100 rupees, which is about $11.25 to about $14. The remuneration had two components. The first was the daily rate, which included food and accommodation costs, and was about $10 US. And the second component was the travel allowance, which was about $2.5 US. Again, the travel allowance also varied depending upon the survey context. For example, in hilly terrains and remote locations, it would go up to, 300 to 400 rupees, or which is approximately, $4 to $5. And in easily accessible areas with easy access to public transport facilities, it ranged between 100 to 200 rupees, which was about $1 to $2.5. Now, actually discussing So just to add, to the wages discussion. So the wages paid to the enumerators was also a function of the minimum wage rate, which was prescribed by the state government, and the average market rate, which was determined by the alternate livelihood opportunities which was available in that region. For example, say surveyors in the state of West Bengal were paid an average of 900 rupees, while say surveyors in the states of Maharashtra and Gujarat were paid about 1100 to 1200 rupees, where the minimum wages prescribed by the state government was higher. And also, just to add how the enumerators perceive this job of, this job, like most of the supervisors, managers mentioned that the enumerators consider this job as a secondary source of income, and particularly in rural contexts where agriculture was the primary source of income. And many enumerators also perceived it as a makeshift job and were preparing for entrance examinations for teaching, clerical, and administrative positions in the government. So, for example, like during the 3IE Commission survey, the data collection organization had to declare holidays in 2 instances where, a government examination was held, because over 70% of the enumerators were on leave that day. So this is mostly considered, as a temporary job, or seen like temporary job to pursue something else, or maybe even some of them see it as a stepping stone to advance their career in research or some domains. Now coming to the health and challenges of the enumerators. In terms of, the health related challenges, they can be classified into 2 types: the physical health challenges and the mental health challenges. So the key physical health challenges reported by the enumerators included seasonal flu, back pain, skin infections, dust allergy, fatigue, which primarily arose due to physical exertion, irregular meal timings, infrequent access to toilets, long travel during data collection. It is important to note that some of these challenges may be context specific, as the survey of surveyors was undertaken in the context of a study focused on low income settlements with precarious sanitation and hygiene conditions, where of course the surveyors were prone to greater risks. However, these challenges were also corroborated, during the manager interviews, where they mentioned that the surveyors were often prone to, such minor physical illnesses, because of the fact of the very nature of the job, because they are often, being the frontline workers, they're often exposed to, remote and unhygienic contexts. Now, frequent occurrence of physical illness increased the out-of-pocket expenditure among the surveyors, as these ailments were not covered under the health insurance provided to the enumerators. And the occurrence of illness also adversely affected their income, because surveyors were not entitled to paid leave and hence lost their wages on days where they were on leave. It was observed that the data collection organizations mostly lacked an institutional mechanism that enabled regular information sharing to manage the everyday health issues on the field. Also, there was lower awareness amongst the enumerators about the claiming procedures of health and accident insurance. The data collection organizations, in fact, all of them provided a group insurance policy that covered medical expenses of all the surveyors, for major health illnesses. However, when we asked the managers about the actual claiming of the insurance, they said that, that is something not very regular or frequently observed. And just to quote, one of the managers, he said that, in my project so far, fortunately, there have been no such medical emergencies where the insurance had to be claimed. But this limited claim of insurance is also emerging from the fact that the enumerators have a short-term contract with the organization, coupled with low procedural awareness about the claiming procedures among the enumerators. Now, in terms of mental health challenges, it included stress and anxiety, which primarily arose again because of the uncertainty associated with the non-permanent nature of the job. As again discussed previously, enumerator jobs are usually short-term contract-based jobs, and the employment opportunities and duration is contingent upon the project requirements. So there's a constant uncertainty associated with what would be the next job, or whether I'll be able to find the next job or not. So that thought is something that consistently lingers in the mind of the enumerators and does take a toll on their mental health. The second mental health challenge was in terms of stringent survey productivity targets. So, just to quote again another enumerator, and this was mentioned in one of the essays of the enumerators. So she mentioned that the constant worry of not being able to find a respondent and completing the assigned productivity target for the day constantly lingers in my mind. Complete, and I think it's mindful. I think it's important to remember that completing the surveys is not just the onus of the enumerator, but also a function of the availability of the respondent. When we calculate, say, the survey productivity, we usually consider the number of fully completed surveys and not the number of the surveys attempted by the enumerator, which may include refusals by respondents to participate in the survey. So further adding to these challenges, the lack of institutional support in terms of counseling and information sharing, and the absence of clear protocol on how to raise concerns around mental health challenges and handle such cases further aggravated, the mental health challenges of enumerators. Some enumerators also reported the potential risk of contracting COVID-19 as a mental health challenge. The 3i Commission survey was conducted during a period when COVID-19 cases were low, but still prevalent. So enumerators, by the virtue of being frontline workers, were more frequently exposed to such situations where they could contract COVID-19. Although the number of COVID-19 cases is decreasing over time across contexts, this was a prominent risk observed during the last 2 or 3 years. In terms of safety challenges, the safety challenges were observed to be gendered, with women enumerators reporting greater risk of harassment and limiting hygiene practices at the workplace. The challenges around menstrual hygiene was reported by almost all the women enumerators. One data collection agency manager said that they provided menstrual hygiene kit with sanitary pads to female enumerator, in fact, all the female field staff. While this is a welcome step, the challenge here is, systemic, in the sense that despite having access to, menstrual hygiene kits, there is a challenge of limited access to clean and safe toilets. And it is important to remember that it is important to note that this challenge is not just a challenge, say, in remote or rural locations, but also in urban areas where public toilet infrastructure is either not available, or if available, is very poorly managed. Further, given that the field team structure is mostly skewed in terms of, say, the supervisors, managers being mostly men, women enumerators also don't feel very comfortable in openly discussing about these issues. And this further limits the establishment of a feedback loop or an open discussion on having measures to overcome these challenges. While all organizations, had a prevention of sexual harassment policy in place, which is mandated by the Sexual Harassment Women at Workplace 2013 Act of the Government of India, it was observed that, this was enforceable for mostly for the internal team or the employees of the survey agencies. It was relatively challenging to enforce this in cases where the community members were involved. So that was one of the major challenges which was quoted by the managers of various data collection agencies. Also, absence of adequate permissions from adequate authorities before conducting the survey added to the risks, the safety risks of the enumerators. Often the data collection agencies, have a protocol. They say that they have a protocol of, getting the required permissions before kickstarting the survey. But, it's again observed that it's mostly seen on the paper and not that accurately implemented. And this kind of, further creates more challenge for safety challenge for the enumerators in terms of accessing the communities for the survey or establishing the trust with the communities. So thus, to overcome these challenges, we propose two types of measures. The first being the institutional measures, and the second being context-specific measures. So institutional measures are mostly, the standard measures, including policies, guidelines, protocols, and practices undertaken by the organization. This is something implemented at an organizational level, while context-specific measures are measures that are specific and that are necessary and suitable for that particular context. So some of the institutional measures that can be undertaken are, firstly, to set up a streamlined feedback system to enable regular communication between enumerators and the higher-ups. So this will help gather real-time, regular inputs from enumerators during pre-field and field phases, and also help strategize and respond to the real-time needs of the field. The second would be to have a holiday and paid leave policy for the field staff. We would recommend at least having one holiday per week, and this would help the enumerators rest and recover from the physical exertion, and also enable them to better manage their personal and professional life. And also in terms of paid leaves, one of the managers, again, during the interview, talked about this case where they actually provided paid leaves to the enumerators who contracted COVID because of the survey during the last 2 years. So, maybe again, depending on the context, the project and the budget availability, the team size, a lot of factors, but depending on all these factors, maybe it would be useful to have a cap on, the number of paid leaves that the enumerators can have, and actually start thinking about this. Then the third would be, planning adequate budget for data collection and field team personnel. Usually, about 40 to 50% of a project of a project's budget is actually, allocated to the data collection exercise. But also there is a general tendency to squeeze this budget and actually manage surveys in lower costs. So it's important to actually change this mindset. And again, in terms of increasing awareness on prevention of sexual harassment and insurance policies, I think the enumerator training provides a platform to actually engage on these issues and create more awareness about these. Maybe a separate session on the prevention of sexual harassment policy as well as on insurance policy during the training needs to be provided to the enumerators, and also the enumerators can raise their concerns, queries, and the survey organizations can actually, the managers can respond to them and create data awareness. Again, appointing a mental health professional or counselor at the data collection organization is important. This not only provides, support to the enumerators during the data collection phase, but also gives, I think, a clear indication on the emphasis laid by the data collection organization to help resolve any mental health concerns. And I think it's important, lastly but not the least, to have mixed gender teams, because mostly we see that the supervisors, the managers are still male. I think mostly the enumerators also are mostly male, but again, it depends on the project. If the project collects a lot of sensitive information and interviews women, there's a tendency to hire more women enumerators. So I think, going forward, it would be useful to have and encourage mixed gender teams across, across different levels of the research team. In terms of context-specific measures, conducting pilot not only focused on the structure, flow, and type of questions of the tool, but also to understand the context-associated challenges is important. What time the respondents are available, whether any required permissions, whether any permissions are required from adequate authorities. Understanding the context along with, understanding whether the tool works or not would be important. Then, yeah, as I said, getting required from adequate authorities prior to data collection is important. In fact, accounting adequate time for the pre-field measures in project timelines. Usually a lot of adequate time is not allocated to all the pre-field measures, in the sense that, the pilot or seeking adequate permissions from the authorities. So even in terms of planning the surveys across different communities, so accounting adequate time for these would be extremely important. And also encouraging and ensuring enumerators take timely meal breaks. I mean, this might come across as very basic, but I think this is something not consciously, not observed to be consciously encouraged, say by the supervisors or managers amongst the enumerators. So making that effort to encourage this would be a much needed step. And also, lastly, providing adequate housing and travel facilities in cases where the location is far from the village or town or the city where the survey is being planned. So yeah, I think that's it from our end. I think we still have a long way to go in terms of adopting these measures and improving and making efforts for improving the well-being of field research staff. But I think recognizing this problem and discussing that would be the first step. I mean, really look forward to your questions, comments, and feedback. And yeah, I'd like to open the floor.
A wonderful presentation. What a important topic you have taken up, really. Our research totally depends on the enumerators. It is their hard work which helps the, they are the backbone of our research project. And their health, well-being would definitely help the even the quality of data that we get in the project. So I really appreciate. Right now I am part of one data collection which we are doing it in rural Maharashtra in Pune district, and I have mostly female students. So I'm in a college university where generally we take students as a field investigators, and we don't pay them. We say that we'll give you, we try to give them a letter of recommendation or a letter of appreciation, and tell them that it will be definitely helpful, understand the primary data collection process, give you field exposure, that kind of. Now, what do you think about employing students as enumerators or investigators in university projects? So are you aware the universities in US have certain policies for taking students as enumerators or field investigators? Because in India, many times we just take them for granted. What is your view on handling students as field investigators or enumerators?
That's why I wanted to talk to you about life after.
So thanks for the question. I am not aware about the US context, and maybe I can request Ted or Alfredo to come in on that. But I think as again in the presentation, as we discussed, a lot of fresh graduates or early career professionals pursue this career, and I'm sure like a lot of students as well, as you mentioned, pursue this as part of their internships, or, you know, just to whoever may be interested in research, you know, would want to like do this as part of their study or during their coursework. So I mean, my view, so again, this is my personal view, but I feel that I think it's okay to hire students as far as, you know, maybe they are paid for the work they are doing. I mean, I'm more for, you know, actually paying them for their work and hiring them during so that it does not affect their studies as well or the coursework as well. Yeah, I'm more of that view. I hope that answers your question. But on the US context, maybe I would invite Ted or Alfredo. Yeah.
Thank you. And just to follow up regarding the misgendered. So you feel like in our case, it can happen. A team may have a professor, male faculty as a supervisor, and generally in arts, we have more girls in the, so it can happen. There are only 6 females and 1 male, 1 boy, you know, of this 2022 age group, and 1 professor, and they are part of one, you know, something field data collection. So when you mentioned about misgendered, you're talking about senior, matlab, the field supervisor and the field investigators. What is it, like senior, junior, or within the field investigators you mentioned there should be girls and boys both in the team?
Right. So it's both. But see, I think among the enumerators still, I think we observe, you know, there are, the ratio is close. I mean, in the sense of the male and female enumerators, it's a mixed group. But when you look at, when you go up the hierarchy, in the sense, you know, when you look at supervisors, the managers, they mostly are males. So for the in the 3IE Commission survey itself, we had in fact more female enumerators than the male enumerators, because you know, I think we had some models for women, and we felt that, you know, a woman interviewing a woman might work better in this context. So you know, we had more female enumerators. So I think in terms of enumerators, I think still there is, we observe that it's a mixed gender group. But when we look at supervisors, managers, it's mostly males across data collection agencies. And in fact, amongst the managers we interviewed also, there was just 1 female manager, and all the supervisors and the rest of the managers were male. So, you know, I think it's important to make an effort to have to encourage more women in these roles, so that you know, so that so that it actually helps create a more gender neutral workplace.
Yeah. Last follow-up question regarding, are there any guidelines about the, like you mentioned about enumerators, you know, the working conditions, training? Are there any guidelines which are available in India which we researchers can follow? You know, sometimes we are the one who design the projects, field projects, or design the data collection process in the university. If, you know, the projects that we get in or bid in, are there any references you would suggest that we should follow? At least we become more aware about the good practices of handling enumerators or training enumerators. Any suggestions, referral books or guidelines? Thank you.
Yeah, I mean, I think there are guidelines, you know, I think JPAL, IP have some guidelines on this. Even 3IE actually is doing some work on survey management, and you know, has released some guidelines on this, which I'll be happy to, you know, share with you. And I think even the 3IE, the newly launched 3IE tree review framework as well, like is a comprehensive assessment of the ethical practices in the entire research lifecycle. It also has a section which asks about, you know, the enumerators and you know, about them basically. So I think basically I think there are guidelines, and I'd be happy to share that with you.
Hi, Indira. Thank you. I just wanted to highlight some of the activity that was going on in the chat. Sarah asked, and would love to hear your perspective on the appropriateness of a research team from Western institutions making requirements or suggestions in different contexts and LMICs. And I believe, Tarek, at some point you had unmuted, so please feel free to also jump in, but would love to hear sort of your thoughts on that, Indira.
Okay, thank you. Yeah, go ahead.
No, please go ahead.
Oh, thank you so much. Anyway, I would love to speak about 2 points. Firstly, I don't know, how did you find the triangulation of data? Is it feasible to do it in our research, or it's not? The second point, it's related to the system. I mean, the democratization of any system. Is it really important in doing research? For example, I used to work in an institute, and we are measuring the trust in the Moroccan community in the king and legislative and other branches. And in many cases, we found that people just like they are saying, yeah, I trust, even you can see in their eyes they are not. So the thing is, I would love to hear from you about this issue related between the democratization of the country and doing and conducting research. Thank you.
Sorry, I missed the last part of the question. The democratization between? Can you comment?
And the relation with conducting research, I mean, on the fields, etc.
Okay. Sorry, my voice is echoing. Right. So to answer your question, yeah. So sorry, Grace, can you help me? Actually, I don't know. I was not able to hear properly.
I heard the democratization of the country and with relation to sort of how research is conducted. But Tarek, please feel free to chat maybe your question. I think there's a little delay in the audio.
And also, could you please repeat the first question that he asked?
The first question that Tarek asked, or the first question that I had highlighted?
Yeah, the one you have highlighted.
Yeah, it was just a comment to get your perspective on sort of the appropriateness of Western institutions who may be conducting this type of research. And, like when Western institutions are making requirements or suggestions for enumerator safety, which are in different contexts in LMICs. And the Sarah, feel free to jump in, but I'll just read her comments, specifically thinking through the power dynamics that may be at play and certain things that we as, we in Western institutions might think are best practices or appropriate might not be contextually or, culturally appropriate. So if you have thoughts on sort of that interaction of what we might think as best practices versus, the application of those to different contexts.
Absolutely. I think that's a very important question, and something we are also very closely thinking about, because the problem here is we do not have any guidelines in say Global South or that we can adhere to or follow. I mean, we kind of rely upon the guidelines created by Western institutions to actually adapt that to the contexts we are working in. And also, just to give you an example, like the IRB, right? For example, of course, this is not about the enumerators, but say from the human subjects participating in the research perspective. But usually it's like a lot of studies happen in Global South, but the IRB committee members mostly sit in the Global North, maybe, and might not be aware about the context of the research, where the research is studies being conducted. So but a lot in a lot of contexts, we don't have local IRBs to go to and actually get their approval, so or get their suggestions and feedback. So we again rely upon a lot of Western IRBs. So yeah, right from IRBs to even guidelines around the field protocols that need to be followed. So these are something that do not exist, and something which we actually look at what exists in the West and adapt that to, say, the Indian context or the South Asian context. I think Chandan, my colleague Chandan, also wants to come in here.
Thanks, Indra. So just to sort of add to this, I guess what is important for like researchers, especially who come in from a different country context, is to basically first make sure that they understand the local practices and they understand the local context, and maybe have say the protocols or the survey instruments vetted by people who have a good understanding of the local context, and then basically have a final draft of the protocol. We've tried to sort of do that in our studies as well, and we've seen that that has sort of helped us avoid difficult situations. One specifically that Sarah mentioned about having having a gender balance specifically in a strong Muslim context. So what I'm trying to hint at is basically having a good understanding of the local context, making sure that you have some representation from that context, maybe in your study team, or maybe have someone who can sort of run through your protocol. So that sort of helps.
So I think Tariq has added his questions on the chat, and so I think his first question was on data triangulation. So in this research, actually, again, as I said, we had 3 sources of data, which was, the responses of the surveyors in the survey, and the discussion or the essays of the discussion around the challenges that the surveyors had written in the field essays, and the interviews of the supervisors and managers. So in terms of triangulating this data, like for qualitative research, we usually use coding, say using NVivo or Atlas TI. You actually develop a coding framework based on themes that you develop, like for the study. For example, like for this study, different challenges could be the themes, different recommendations could be themes. And again, under themes, there are sub-themes, like, in health challenges, it's a physical health challenge, and in physical health challenge, it's a minor illness, it's a major illness. So you actually code different interviews, essays, or different sources of data, and actually bring them together and see where actually they align, where they do not align. And yeah, I think that's how you kind of triangulate the data. I don't know if you were asking, if I actually answered your question, but yeah, that was on triangulation. And in terms of the quality of data collected by female enumerators, comparing that with male enumerators, I think at least in the 3IE Commission survey, we did not find much difference between the quality of data. I think it depends on the enumerator training. And I think if you actually, I think a lot of data collection agencies, I think it's so important for the data collection agencies to really give a lot of importance to the training and just hit the field only if they feel confident about the training. I feel that maybe, at least in this context, female enumerators might have had a better access to the respondent because, mostly like the women were available in the household in this context, at least. So in terms of access, maybe the female enumerators might have had a better access to the respondent over the male enumerators, but in terms of quality of data, there was absolutely no difference.
Do we have any other questions? Or I don't know if Alfredo or Indira want to make any final comments or?
I'm good. Thank you so much for the comments. I've read some of the comments and took some notes here of participants. You know, feedback, really interesting stuff. I appreciate the interesting conversation and discussion also from Indira.
It was really a great conversation. I'm glad we got into these topics. It feels like there's so much more to discuss. And again, hopefully there were so many people in the chat that wanted to follow up and had, really wanted to keep the conversation going. So hopefully this session is just the beginning of a discussion that we all have as a community on these important issues. I don't know, Grace or Iman, if you have other things to add.
Nothing else to add, but just to, give a thank you again to both Indira and Alfredo. And just to remind everyone that we will be sharing this recording through our different platforms, our website, social media, our YouTube. And please just stay in tune with us so we can have you join us for our April 20th session on building student-led reproducible research. So thank you so much for joining, and we'll see you all soon.
Thank you, everybody.
Thank you so much.